Okay, we're going to go over now how to correctly roll on your liner. And as you see, we've got Robin's liner here. This is a silicone liner, typical of what you'll see with a suction socket. It's going to have nothing on the bottom, no pin, and it's just going to be the size of her leg. We've measured so that we make sure we get the right size. And one of the neat things about this particular liner is with some you'll have to put them on a certain way every time. But with this one you won't have to. So we'll be able to roll this on anyway. The outside is the one that you can feel the lettering. And it's also got a label on the back or the front or whatever side that is. So what we're going to do is we're going to roll the liner inside out. So the easiest way to do this, and everybody has their own little method, is reach in and pinch the bottom. Take the top and pull it towards you. And we're going to make sure that we get the bottom of it puckered out. What we don't want is to roll it on like this. That will capture air in the bottom of the liner and it'll create a sensation on the bottom with a lot of pain and redness. It'll act like a hickey, constantly sucking and pulling on the bottom of that skin. So we make sure we get the tip of it out. Now, keeping firm pressure, I'm going to push it on so that it's centered on the bottom of the residual limb, and pinch and open up your hands as you roll it on. And when you get to about right here, make sure that you keep pressure. We don't want to have any air getting inside the liner. You can bring your hands back down and roll it up. The whole time making sure that we roll with even pressure. Okay? Now this liner is obviously it's a little bit long for Robin, so we may or may not trim it down. It depends on what she wants. We can trim it just above the knee, trim it wherever we feel like it's comfortable. Again, I'm going to go over some incorrect roll-on methods. And then we're going to let Robin show us what she's capable of. Don't want to do this.
Yes, I've done that. It hurts.
And when you did that, Robin, what did you get? What kind of...
It felt like something was pulling constantly right there.
Okay.
Yeah.
And when you roll off
I knew
your liner,
something was wrong.
Good.
Yeah.
And that it's going to be obvious to you that it's not right. It shouldn't be uncomfortable. That's the big thing.
Yes.
And when she rolled it off, I wasn't there, but I guarantee you she had redness and a round circle down here.
Yeah,
okay.
I did.
Good. And that's especially important for diabetic patients or patients that have pretty new suture lines, because if you can bust open one of those suture lines or get blisters, if you're diabetic, that can turn into a large problem. Or you could just be set back with anybody. You could have problems where we have to put you out of a prosthesis for a couple more weeks to let it heal. We don't want to put anybody behind. So we get it on correctly. When you get to this point, we don't want to see you do this. Now obviously there's going to be wrinkles and stuff if we do that. She would have kept pulling, but by pulling it that way there's a possibility to get air trapped in the liner. We don't want you to have that problem. So we're going to roll it off and start over. And again, nice even pressure. Keeping the roll the whole time. It's okay to get wrinkles back here. Robin can show you that you just make sure you get them worked out. And now Robin, I know putting you on the spot here, what does that feel like? Is it a nice, good, tight squeeze?
Yes. It's even squeeze. It feels good.
Good.
Yeah, you should feel it all evenly.
Yeah.
And it just, so that's how I know it's right. It should never hurt anywhere or feel
good.
Tighter in one area.
One thing to keep an eye out for is if you have an area down here with a lot of squeeze, or if it hurts too much around any of the bony areas, let us know, because we could have a liner that's too small for you. If you have a liner that you can really get your hands in there and it doesn't feel tight, it may be too loose. So that's important for us to know. So Robin, I want you to roll it off and roll it back on for us. When you take the liner off, there's not really a right or wrong way to do it. Just make sure you're real careful. We don't want to rip it.
Okay.
So now she's going to roll it on for us.
And I just keep my hands tied around it until I get all the way up.
Perfect.